Hi, I'm Dr. Zong, a board-certified medical oncologist and integrative medicine practitioner. Today, I'd like to talk about the use of supplements in cancer patients. As we're aware, more and more people are turning to supplements, particularly herbal medicines, for their health, especially for cancer-related conditions. However, it's important to understand that these supplements are not appropriate for immediate or emergency medical situations, nor should they be the sole treatment for serious illnesses like cancer. There are several risks associated with using herbal remedies. Firstly, the quality of herbal preparations may be unreliable, which can cause problems. Secondly, their effectiveness is often not properly evaluated, and we may not fully understand their potential side effects, or how they interact with other medications or foods. Therefore, it's crucial to consider these factors, and have a good understanding of them. Nevertheless, when used regularly and as intended, side effects from supplements are rare. In fact, using specific supplements alongside cancer treatment can be beneficial, and it is recommended to consider them as part of a comprehensive approach to oncology treatment.
First and foremost, let us start with several important messages that arise from large-scale clinical trials. These messages, whether welcomed or not, present us with real data that shape our understanding of the relationship between nutritional supplements and cancer. Nutritional supplements are commonly used by cancer patients, as they perceive them to be anti-cancer and anti-toxicity agents. However, it is essential to consider the evidence from clinical trials to guide our understanding of their effects. Clinical trials have demonstrated that beta-carotene and vitamin E supplementation may have unintended consequences. In the general population, these supplements have been associated with an increased risk of lung, stomach, prostate cancer, and colorectal adenoma, as well as overall mortality. When it comes to radiotherapy, vitamin E and beta-carotene supplements may reduce toxicity. However, an associated increase in recurrence, particularly among smokers, has been observed. The effects of supplements on chemotherapy toxicity are variable, but there is currently insufficient data to draw definitive conclusions regarding outcomes. These important messages derived from clinical trials shed light on the complexities surrounding the use of nutritional supplements in the context of cancer. As we navigate this landscape, it is crucial to rely on evidence-based information to inform our decisions and ensure the best possible outcomes for patients.
Moving forward, NAC, N-acetyl-L-cysteine, known for its potent antioxidant benefits, should be avoided in the context of cancer treatment. The impact of NAC on cancer outcomes remains uncertain, and caution is warranted. If you are currently taking statin medications, as a repurposed cancer treatment, it is advisable to avoid supplemental CoQ10. Further research is needed to fully grasp its implications in this particular situation. When supplementing with melatonin, it is important to be mindful of the dosage. Limiting the intake to no more than 20 mg per night is recommended. Higher doses may not yield additional benefits and can be unnecessary. Pure and synthetic forms of lycopene should be approached with caution. Instead, consider incorporating lycopene-rich foods into your diet, as a preferred method rather than relying solely on supplements. Lastly, it is advised to steer clear of red yeast rice supplements. Potential interactions and variable product quality raise concerns about their safety and efficacy.
I would like to present to you the main essence of my recommendations regarding supplements. When we consider supplements, two supplements stand out as being of utmost importance: vitamin D and melatonin. These recommendations are supported by data derived from reputable sources such as clinical trials conducted in Europe and Harvard. The consistent findings from these studies reveal real clinical benefits. Let us now get into the specific dosage recommendations for these supplements. For optimal results, it is recommended to include a daily dose of vitamin D ranging from 4,000 to 8,000 IU, international units. However, it is crucial to individualize the dosage based on blood levels, tailoring it to suit your specific needs. To ensure proper monitoring and adjustment, regular assessment of the 25O vitamin D levels every 3 months is advised. The ideal target level to aim for falls between 75 and 100. As far as melatonin, a supplement known for its role in sleep regulation and other physiological processes, as well as anti-cancer properties, the recommended dosage stands at 20 mg per night. This dosage has shown promise in supporting overall well-being and improving the survival of cancer patients. These recommendations are not mere conjecture but are backed by substantial evidence from renowned sources. The consistent findings from these rigorous studies reveal real and tangible clinical benefits.
I currently utilize a dozen supplements in my practice, which collectively address the majority of the 15 cancer hallmarks we discussed earlier. These supplements represent a holistic approach to targeting cancer hallmarks. Now, I will provide a comprehensive overview of each of these supplements to give you a better understanding of their individual benefits and how they contribute to the overall treatment approach.
Let us talk about usage and potential side effects of artemisinin. Artemisinin is commonly known by and related to various names such as Qinghao, sweet sagewort, and sweet wormwood. When it comes to dosage, it is recommended to take 200 mg of artemisinin daily. However, it is important to be aware of possible side effects that may arise from artemisinin supplementation. These side effects include skin rash, hearing loss, ringing in the ears, and dizziness. It is crucial to monitor your body's response to the supplement and consult with a healthcare professional if you experience any adverse reactions. A juicing from Artemisia or sweet wormwood has been used in ancient China for centuries to treat various conditions such as fever, inflammation, and malaria. Within this plant of sweet wormwood lies a compound called artemisinin, which has paved the way for modern medicine. It serves as the foundation for a malaria drug called artesunate, which doctors widely prescribe today to combat this devastating disease. But the wonders of artemisinin extend beyond malaria treatment. It has been discovered that cancer cells heavily rely on iron for their growth and spread. When artemisinin and iron enter a cancer cell together, they create molecules known as free radicals. These free radicals initiate a process called apoptosis and ferroptosis, which ultimately leads to the destruction and kill of cancer cells. The induction of free radical-dependent apoptosis and ferroptosis by artemisinin has shown promising anti-cancer activity. However, it is important to note that the effect of artemisinin can be diminished by the presence of NAC, N-acetyl-L-cysteine. Thus, caution should be exercised when considering the concurrent use of artemisinin and NAC. In conclusion, the discovery of artemisinin's anti-cancer properties and its ability to induce ferroptosis represents a significant advancement in our fight against cancer. The rich history of artemisia's medicinal use in ancient China continues to inspire modern research, offering new possibilities for improved cancer treatments. Berberine, an alkaloid with a vibrant deep yellow color, is found in various plant species, most notably Chinese goldthread, Coptis chinensis. This remarkable compound has been revered for its beneficial properties for centuries in China. In traditional Chinese medicine, berberine has long been utilized to address a wide range of health concerns. It has been employed to combat infections, alleviate diarrhea, and manage inflammatory disorders. Within China, berberine is frequently incorporated as an adjuvant treatment for conditions such as type 2 diabetes, hyperlipidemia, and hypertension. Additionally, there is emerging evidence pointing towards potential anti-tumor effects of berberine. Berberine has exhibited impressive abilities to impede the proliferation of cancer cells. It accomplishes this by inducing apoptosis, regulating the cell cycle, and modulating autophagy. Furthermore, berberine inhibits tumor cell invasion and metastasis. It also shows promise in hindering the process of epithelial mesenchymal transition. Additionally, berberine has been recognized as an inhibitor of mitochondrial functions, further contributing to its potential therapeutic effects. Preclinical studies have explored the therapeutic efficacy of berberine across various types of cancers, including colon, breast, pancreatic, liver, oral, bone, cutaneous, prostate, intestine, and thyroid cancers. However, it is important to note that clinical studies in cancer patients are limited, and further research is needed to fully understand berberine's potential in clinical settings. Nevertheless, a comprehensive study highlighted the safety and effectiveness of a daily dose of 0.3 grams of berberine taken twice daily in reducing the risk of colorectal adenoma recurrence. Berberine is generally well tolerated, with reported side effects being mild and infrequent. These may include anorexia, upset stomach, diarrhea, constipation, and rash. It is worth noting that cases of hepatitis associated with berberine usage have been reported, underscoring the importance of medical supervision and monitoring during its administration. Curcumin is a substance found in the turmeric plant. Turmeric has been used in traditional Chinese medicine for a long time. In modern medicine, it has been recognized for its ability to reduce inflammation. Now you can find turmeric in pharmacies and stores in different forms like powder, liquid, capsules, or tablets. Turmeric is also commonly used in cooking as a part of curry powder. The amount of curcumin in turmeric can vary between 1% and 7% of its weight. However, curcumin has poor bioavailability and stability, which makes it challenging to assess its effectiveness. Scientists are working on improving its bioavailability using nanotechnology. When it comes to its effect on tumor diseases, the concentration of curcumin is crucial. In small amounts, it acts as an antioxidant, while high concentrations can have a pro-oxidative effect. Laboratory studies suggest that curcumin may have preventive effects against carcinogens by combating oxygen radicals and affecting cell membranes. In mouse studies, curcumin has shown the potential in inhibiting the growth of certain cells, reducing inflammation, and promoting cell death in cancer cells. However, there is a lack of phase 3 large clinical studies to confirm the anti-tumor activity of curcumin. More research is needed to understand its effectiveness in treating cancer in humans.
A clinical trial was conducted to evaluate the effectiveness of using curcumin in combination with Gemzar, a chemotherapy drug for patients with pancreatic cancer that is resistant to chemotherapy. The preliminary results showed promising outcomes, although the sample size was small. The observed median survival time was 5.4 months, and the 1-year survival rate was 19%. This suggests that the combination treatment may improve survival in these patients. Additionally, a separate study involving 20 patients with pancreatic cancer was conducted at the MD Anderson Cancer Center. In this study, patients were treated with curcumin alone at a dose of 8 grams. Out of the 20 patients, 2 showed signs of clinical biological activity. 1 patient had ongoing stable disease for more than 18 months. Curcumin, the bioactive compound found in turmeric, has been recognized for its diverse health benefits. However, due to its weak solubility and bioavailability, the effectiveness of curcumin as an oral medication has been limited. For instance, in a phase 2 clinical trial for advanced pancreatic cancer, a daily dose of 8 grams of curcumin resulted in only 22 to 41 nanograms per milliliter of plasma concentration. One approach to overcome this limitation is to increase curcumin's bioavailability through bioenhanced formulations. These formulations are generally categorized into 3 generations, each aiming to improve curcumin's absorption and efficacy. The first-generation formulations incorporated significant amounts of adjuvants like piperine from black pepper, turmeric oils, or other natural compounds to inhibit key detoxification enzymes. This strategy aimed to extend the absorption time of curcumin by slowing its metabolism. Examples of these first-generation formulas include curcumin piperine, C3-complex piperine, C3-complex/bioperine, curcumin with turmeric fiber or oil, BCM95, and curite. In the second-generation formulations, emulsifiers like carbohydrate complexes and phospholipid complexes were employed to enhance curcumin solubility. BioCurc, Cavacurcumin, Curcumin, Hydrocurc, Meriva, Nanocurcumin, Novasol, Theracurmin, and Termipure Gold are examples of such second-generation formulas. While plasma curcuminoid levels do rise with these formulas, most of the increase is through conjugated metabolites which have shown to lack significant biological effects due to their large size. This has made it crucial to deliver curcumin in its natural, unconjugated form, or free form, to maximize its therapeutic effects. Third-generation curcumin formulations, such as Longvita and Curcfin, have addressed this need. They have managed to enhance the bioavailability, membrane permeability, and cellular uptake of free curcuminoids, without the need for artificial emulsifiers like polysorbates. This progression in curcumin formulation technology continues to unlock the full potential of curcumin as a therapeutic compound. Right now, I suggest sticking with the first-generation curcumin supplements. They have a lot of clinical evidence showing that they work. Although the third generation seems promising, We should wait until we have enough clinical data showing that they are safe and effective before making the switch. Dehydroepiandrosterone, also known as DHEA, is a naturally occurring steroid, produced by the adrenal glands. It serves as a metabolic precursor, for the synthesis of androgen and estrogen hormones. Interestingly, as far back as 1960, it was discovered that DHEA exhibited uncompetitive inhibition of glucose 6-phosphate dehydrogenase, G6PD, activity. G6PD is a crucial enzyme in the pentose phosphate pathway, PPP, a key metabolic pathway of glucose. The dysregulation of proteins within this pathway has been implicated in cancer development. G6PD, being the first and rate-limiting enzyme in the PPP pathway, plays a significant role in cancer progression. It is often upregulated in various types of cancer. This has led to the exploration of G6PD inhibition as a potential therapeutic strategy for cancer treatment. In this regard, both competitive, such as 6-AN, and uncompetitive, such as DHEA, G6PD inhibitors, have been widely studied in the context of cancer research. Additionally, certain natural or synthetic compounds have also shown inhibitory effects on G6PD activity. DHEA, as an effective inhibitor targeting G6PD in the PPP pathway of cancer cells, can reduce the levels of NADPH, a product of G6PD activity, and subsequently decrease NADPH-dependent oxygen-free radical production and nucleic acid synthesis, ultimately inhibiting tumor development. Studies have demonstrated that DHEA can inhibit G6PD activity in cervical cancer cells, induce cancer cell apoptosis, and lead to reduced cell migration and proliferation abilities. These findings highlight the potential of G6PD inhibition, including the use of DHEA, as a promising therapeutic approach in cancer treatment. However, further research is necessary to fully understand the mechanisms involved, and to explore the clinical implications of these inhibitory effects. DHEA, when used in clinical settings, is administered at various doses, ensuring safety and efficacy. Here are some commonly used dosages. Low dose. A low dose of DHEA is typically around 10 mg. High dose. In certain cases, a higher dose of DHEA may be prescribed, ranging from 500 mg up to a duration of 2 months. Average dose. The average daily dose of DHEA falls around 100 mg or 75 mg. This dose is commonly prescribed for extended periods, providing a balanced and effective level of supplementation. Let's take a closer look at some clinical studies exploring the use of DHEA for cancer treatment. One study aimed to evaluate the safety and effectiveness of dehydroepiandrosterone, DHEA, an androgen precursor, in combination with an aromatase inhibitor, AI, for patients with androgen receptor AR-positive metastatic breast cancer. This study followed a 2-stage phase 2 trial design, and included 2 cohorts of patients. The first cohort consisted of individuals with estrogen receptor, ER-positive metastatic breast cancer, that had shown resistance to AI treatment. The second cohort comprised patients with triple-negative metastatic breast cancer. The patients received an oral dose of 100 mg per day of DHEA, alongside an AI to prevent the conversion of DHEA into estrogens. The primary endpoint of the study was the clinical benefit rate, but it's worth noting that the cohort with triple-negative metastatic breast cancer was closed prematurely. The results of the study revealed that 12 patients with ER-positive metastatic breast cancer were enrolled. Adverse events related to DHEA were reported in 4 patients, including mild symptoms such as fatigue, erythema, transaminitis, drowsiness, and musculoskeletal pain. Encouragingly, 1 patient with AR gene amplification and ER-positive disease demonstrated clinical benefit. The study found that DHEA exhibited excellent safety, but demonstrated limited effectiveness in treating metastatic breast cancer. However, it is worth noting that having 1 positive response in 12 AI refractory patients, using only a natural supplement, is not without significance. Further research is warranted to explore optimal dosages, patient selection, and potential combination therapies, to enhance the efficacy of DHEA in this patient population. Diindolylmethane, DIM, is an intriguing compound derived from indole-3-carbinol. Indole-3-carbinol is naturally present in cruciferous vegetables like broccoli, cabbage, and cauliflower. DIM has garnered significant attention as a chemoprotective agent for breast and prostate cancer. As the most extensively studied metabolite of indole-3-carbinol, DIM has emerged as a promising candidate. In laboratory experiments and animal studies, DIM has demonstrated several notable effects. It exhibits anti-inflammatory properties, curbing inflammation within the body. Additionally, DHEA has shown antiproliferative characteristics, hindering the growth and proliferation of cells. However, it is important to acknowledge the limitations in our current understanding of DHEA's impact on human health. Research involving human subjects remains limited to phase 1 studies, preventing us from drawing definitive conclusions. Some data indicate that daily DHEA supplementation may benefit patients with castration-resistant prostate cancer. Furthermore, the effects of DHEA on estrogen metabolism in postmenopausal women with a history of early-stage breast cancer require further investigation. Despite its potential benefits, it is essential to consider the potential side effects associated with DHEA supplementation. These effects, including mild gastrointestinal discomfort such as nausea, diarrhea, bloating, acid reflux, and flatulence, are typically mild, uncommon, and reversible. Occasionally, individuals may notice a harmless darkening of urine, which occurs due to the excretion of colored DHEA metabolites. When it comes to determining the appropriate dosage, it is crucial to consult current research and expert recommendations. While a standard starting dose of 75 mg twice daily has been suggested, recent studies indicate that a dose of 225 mg twice daily may be more beneficial. Notably, even higher doses of up to 1,000 mg have been studied without reporting any serious adverse events. Green tea is an immensely popular beverage worldwide, second only to water. Its consumption has long been associated with various health benefits, particularly its potential chemopreventive efficacy. A comprehensive search of the literature reveals over 10,000 published studies focusing on the effects of green tea on cancer, predominantly examining its chemopreventive properties. It is widely acknowledged that the cancer chemopreventive effects of green tea are largely attributed to its polyphenols, specifically catechins. The primary catechin found in green tea is EGCG, epigallocatechin gallate, which accounts for 50% to 80% of the catechins present, equivalent to approximately 200 to 300 mg per brewed cup of green tea. EGCG has also exhibited other beneficial effects in various studies, including those related to diabetes, antioxidant activity, Parkinson's disease, Alzheimer's disease, stroke, and obesity. The cancer preventive effects of EGCG are strongly supported by evidence from epidemiological investigations, cell culture studies, animal experiments, and clinical trials.
In a phase 2 study conducted by the Mayo Clinic, polyphenol E, with a dosage of 2,000 mg, was administered twice daily, to a group of 42 patients for a duration of up to 6 months. Clinical results showed that 13 patients, or 31%, experienced a stable decrease in their absolute lymphocyte count. Furthermore, among 29 patients who had noticeable adenopathy, 20 or 69% reported a reduction in the total of all nodal measurements. In total, 29 patients, equating to 69%, met the conditions for a biological response. Side effects were rare, with 1 case each of transaminitis, abdominal pain, and fatigue being reported. The phase 2 trial revealed that daily oral intake of epigallocatechin gallate, EGCG, was generally well received by patients. Notably, a sustained decrease in leukemia cells and lymphadenopathy was recorded in the majority of the patient group.
In terms of side effects, EGCG is generally considered safe, and green tea as a whole is also regarded as safe for consumption. However, there have been rare instances of hepatotoxicity reported, in relation to green tea extracts, that contain high levels of EGCG. In some cases, individuals experienced symptoms such as nausea, abdominal pain, and transaminitis, elevated liver enzyme levels, after consuming high doses of EGCG, such as 2,000 mg orally twice per day. On the other hand, when used in the context of high-grade prostatic intraepithelial neoplasia, a precursor to prostate cancer, EGCG at a dose of 200 mg twice daily for 1 year was found to be safe. It is important to note that adverse reactions are rare, and the majority of individuals can consume green tea and EGCG, without experiencing any significant side effects. In our clinic, we take extra precautions when administering EGCG to patients, by closely monitoring their progress through routine blood tests.
FUCOIDAN is a sulfated polysaccharide found in the cell walls of brown seaweed. FUCOIDAN has garnered attention for its potential health benefits and its impact on certain aspects of our physiology. In humans, Dietary fucoidan has been shown to modulate platelet aggregation through its antithrombotic effects. A small study involving breast cancer patients revealed that the administration of fucoidan alongside letrozole or tamoxifen was well tolerated, and it did not result in any clinically significant interactions. Clinical studies have also shed light on the potential of fucoidan in improving the mobilization of blood stem cells. When used alongside the standard of care, fucoidan has enabled patients to continue chemotherapy, reduce fatigue, and lower levels of inflammation. While fucoidan has demonstrated potential health benefits, it is essential to be aware of possible side effects. Diarrhea has been reported, although it is worth noting that this symptom improved immediately after discontinuing fucoidan administration. It is important to note that fucoidan possesses anticoagulant properties. This means that it may have additive effects when used in conjunction with other anticoagulants, such as warfarin and heparin. It is crucial to exercise caution and closely monitor patients who are on anticoagulant therapy while considering the use of fucoidan. In terms of dosage, the usual recommendation for fucoidan is 500 mg taken twice daily. Natural products from the sea, like certain types of seaweed, can be good sources for possible cancer treatments. Of note, seaweed is a common herb used in traditional Chinese medicine for cancer treatment for centuries. Fucoidan is a complex sugar found in the cell walls of these seaweeds. This substance has been noticed for its possible health benefits and its influence on our body functions. Fucoidan can have different sizes depending on how it's extracted. There is a small-sized version of fucoidan, known as low molecular weight fucoidan, LMF, that is usually more active than the large-sized fucoidan. Fucoidan has been shown to interact with several cell processes. It has been found to block multiple pathways in cells. It also interacts with certain proteins and hormones. In humans, fucoidan from our diet can help control the clumping of platelets, which are parts of the blood that help with clotting. It can do this through its anti-clotting effects. In a small study with breast cancer patients, giving them fucoidan with certain cancer drugs was safe and did not lead to any important side effects. Fucoidan can also help increase the movement of blood stem cells. It helps patients continue with chemotherapy, reduce tiredness, and lessen inflammation when used with standard treatments. Dr. Tachikawa Daisuke from Japan has used fucoidan to help patients with many different types of cancers. These patients took fucoidan while they were undergoing surgery, chemotherapy, or radiotherapy. They typically took 1 to 5 grams of fucoidan daily. Although fucoidan has shown potential health benefits, there might be some side effects. Diarrhea has been reported but stops when fucoidan use is stopped. Fucoidan also has anti-clotting properties. This means that it might enhance the effects of other anti-clotting drugs like warfarin and heparin. It is important to be careful and closely watch patients on anti-clotting drugs if they are also considering the use of fucoidan. As for the dosage, it's usually recommended to take 500 mg of fucoidan twice a day. But studies using doses of 4 grams show it is still safe at higher doses. I am going to discuss a subject of immense significance, a ray of hope for patients diagnosed with advanced stage colon cancer, and perhaps for many other forms of cancers too. The researchers from the Republic of China, with the help of HiQ Marine Biotech International, have dedicated their efforts to exploring new vistas in oncology, and their most recent study centers around a novel treatment strategy using a product rich in low molecular weight fucoidan, or LMF, a compound derived from marine brown algae. Over the past few years, they have meticulously conducted a clinical trial using LMF powder, with a dosage of 4 grams given twice a day. The target demographic for this study was patients afflicted with advanced stages of colon cancer. The main focus of the study was the disease control rate, or DCR. For those unacquainted, DCR is a crucial parameter that comprises 3 responses to treatment: complete response, CR, partial response, PR, and stable disease, SD. The outcome of the trial proved to be significantly promising. Patients receiving the fucoidan treatment exhibited a considerably higher DCR -92.8% compared to the 69.2% observed in the control group. Furthermore, The advantages of FUCOIDAN treatment go beyond the DCR. Researchers observed a positive trend towards improved overall survival time in the group of patients who were administered the FUCOIDAN powder. Their average survival time was 18 months, which represents an enhancement of 6 months compared to the 12 months noted in the control group.
Garcinia cambogia, also known as Garcinia Gummi-gutta, is a plant indigenous to Southeast Asia. It has been traditionally used in herbal medicine and as a flavoring agent. Many products promoting weight loss or bodybuilding contain an extract of this plant, specifically its active compound called HCA, a short form of hydroxycitric acid. HCA has been found to decrease the synthesis of fatty acids by competitively inhibiting ATP citrate lyase, an enzyme responsible for converting citrate derived from mitochondria into acetyl-CoA. Acetyl-CoA is a precursor for both fatty acid and mevalonate synthesis pathways. In cancer cells with high levels of aerobic glycolysis, ATP citrate lyase is upregulated, and HCA can also inhibit its activity. By increasing citrate levels in the cytoplasm, HCA may potentially reduce glycolysis. Consequently, the reduction of acetyl-CoA units leads to less fatty acid biosynthesis and lipogenesis, particularly in individuals following a high carbohydrate diet. Pharmacological and clinical studies have suggested that HCA intake up to 2,800 mg/day is safe. However, there have been reports of certain side effects associated with the consumption of Garcinia cambogia. These include ocular complications and hepatic toxicity, either due to the combined use of multiple ingredients or as a result of exceeding the recommended dosage, or simultaneous use with other medications. It is important to note that although most studies have shown Garcinia supplements to be safe in humans, cases of hepatotoxicity, serotonin toxicity, and mania have been reported. Therefore, individuals with underlying conditions such as cancer, diabetes, depression, or other chronic diseases should exercise caution when using Garcinia or HCA supplements, as there is a potential for interactions with medications.
Krill oil is a supplement derived from a small marine animal resembling a shrimp. Krill oil is known for its richness in omega-3 fatty acids, specifically eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHEA, which offer numerous health advantages. However, it is crucial to be aware of some key factors when considering the use of krill oil. Firstly, individuals with bleeding disorders should exercise caution, as krill oil can slow blood clotting, potentially increasing the risk of bleeding. Additionally, for individuals with a seafood allergy, it is possible to have an allergic reaction to krill oil supplements as well. Moreover, if you are scheduled for surgery, it is important to note that krill oil can affect blood clotting and may increase the risk of bleeding during and after the procedure. It is advisable to discontinue the use of krill oil at least 2 weeks before any scheduled surgery, ensuring optimal safety during the surgical process. Typically, krill oil has been used by adults in doses of 1 to 4 grams taken orally daily.
In 1958, a team of scientists led by Dr. Lerner at Yale University discovered a new hormone, which they named melatonin. This was the first hormone ever found in the pineal gland, a small gland in the brain. It took them 3 years of intense research, and over 250,000 beef pineal glands to figure out how to isolate melatonin. Now melatonin is available in every health store. Today, we understand that melatonin is a natural hormone, made by our own pineal gland. This hormone gets released into our bloodstream, and performs many important roles in our bodies. For instance, melatonin helps regulate our sleep and internal body clock, also known as circadian rhythms. It also impacts our reproductive system, bone health, and even how we age, and fight off diseases. In more recent years, a lot of research has shown that melatonin might have some anti-cancer properties. It seems like it can trigger cancer cells to self-destruct, a process called apoptosis, stop the spread of tumors, and block the formation of new blood vessels that tumors need to grow. Melatonin can do its job by attaching to certain places on cells called membrane receptors, MT1 and MT2, or nuclear receptors. In addition to this, melatonin can also work in ways that don't involve these receptors, like acting as an antioxidant and fighting off harmful molecules called free radicals. Another point that's really important is that melatonin seems to be able to target cancer stem cells through multiple pathways. This could be important for developing a curative modality for cancer, since cancer stem cells are responsible for recurrence. A joint research study between Harvard University and Brazil has found that using 20 mg of melatonin can be beneficial for cancer patients. This dose is more effective than a 6 mg dose. Previous studies used a method called meta-analysis, which combines data from multiple studies, to find out the effects of melatonin. In the meta-analysis, melatonin helped reduce feelings of tiredness, asthenia, nausea and vomiting, low blood pressure, hypotension, and a low number of platelets in the blood, thrombocytopenia. These are all common issues that can affect cancer patients. The Brazil-Harvard study also found that 20 mg of melatonin improved the brain's executive function, which is responsible for tasks like planning and problem solving, improved memory and recognition abilities, helped reduce symptoms of depression, and improved sleep quality. So, current research shows that melatonin can offer a range of benefits for people dealing with cancer. Scientists carried out a detailed systematic review of several trials that were carefully controlled, randomized controlled trials, or RCTs. These trials looked at the use of melatonin in patients with solid tumors and whether melatonin affected their survival after 1 year. They combined all the results of these trials into one big analysis, a meta-analysis. They looked at 10 different trials that were carried out between 1992 and 2003, involving a total of 643 patients. All these trials involved patients with solid tumor and were conducted in the same hospital network. The trials weren't blinded, which means the doctors and patients knew what treatment was being given. What they found was that melatonin reduced the risk of death after 1 year. This effect was seen no matter the dose of melatonin or the type of cancer being treated. The dose of melatonin was 20 mg per night. Also, no serious side effects were reported. This big drop in risk of death, along with a lack of serious side effects and low cost of melatonin, suggests that it could be very useful for treating cancer. However, before we can be sure about how effective and safe melatonin is for cancer treatment, more trials need to be done. These trials should be blinded, so no one knows who's getting what treatment, and carried out independently. I'd like to share with you a major medical study from Thailand. They studied 151 patients who have a type of lung cancer called non-small cell lung cancer. These patients were divided into 3 groups. One group received a fake medicine called a placebo, one group received 10 mg of melatonin, and the final group received 20 mg of melatonin. While the average survival time of the patients didn't really change between the groups, something interesting happened 22 months after the study started. At this point, only the patients who had been taking melatonin were still alive. Even more interesting, the group that took 20 mg of melatonin had more surviving patients than the group that took 10 mg. So, this study suggests that melatonin could help patients with cancer live longer, especially at higher doses. Niacin, also known as nicotinic acid, is an essential nutrient, and a member of vitamin B3. Its amide derivative, nicotinamide, also called niacinamide, is a key component of coenzymes such as nicotinamide adenine dinucleotide, commonly referred as NAD, and nicotinamide adenine dinucleotide phosphate, or NADP. While niacin and nicotinamide have the same vitamin activity, it's important to note that nicotinamide lacks the pharmacological lipid-modifying effects and side effects associated with niacin. Niacin is available both as a vitamin, marketed as a dietary supplement, and as a prescription medicine in the United States. The recommended dose of niacin as a vitamin is 16 mg. Over-the-counter, OTC, niacin supplements come in various formulations, with typical doses ranging from 50 mg taken orally every 12 hours to 100 mg taken orally once a day. When niacin is used as a medication to treat elevated cholesterol and triglyceride levels, the daily doses can range from 500 to 3,000 mg per day. Immediate release niacin is typically initiated at a dose of 250 mg taken orally once daily. The dose or frequency can be adjusted every 4 to 7 days based on the desired effect and the individual's tolerance. The first level therapeutic dose is typically between 1.5 or 2 grams taken orally divided every 6 to 8 hours, with adjustments made every 2 to 4 weeks. The daily dose should not exceed 6 grams. Extended release niacin is typically initiated at a dose of 500 mg taken orally once a day at bedtime. Similar to immediate release niacin, the dose can be adjusted every 4 weeks based on the desired effect and tolerance to a therapeutic dose of 1 or 2 grams taken orally once daily. The daily dose for extended release niacin should not exceed 1 or 2 grams. Side effects of niacin can include flushing, gastrointestinal distress, and pruritus, itching. It is important to note that chronic overdose of niacin has been linked to hepatitis. In a study involving breast cancer patients, niacin was administered in combination with CoQ10, coenzyme Q10, and riboflavin, alongside standard care treatment using tamoxifen. The study randomly assigned 84 breast cancer patients to receive a daily supplement consisting of 100 mg of CoQ10, 10 mg of riboflavin, and 50 mg of niacin, in addition to 10 mg of tamoxifen taken twice a day. Before treatment, the patients exhibited elevated levels of serum CEA carcinoembryonic antigen and CA15.3, cancer antigen 15.3, which are commonly used as tumor markers in breast cancer. Upon receiving tamoxifen therapy for over 1 year, the patients experienced a significant reduction in their tumor marker levels. Remarkably, when niacin supplementation was introduced in conjunction with tamoxifen, there was a further significant reduction observed in the tumor marker levels of the patients. This suggests that the addition of niacin to the treatment regimen had an additional positive impact on tumor marker reduction in breast cancer patients. Let's dive into clinical studies focused on nicotinamide. In a double-blind, randomized, controlled trial, involving 386 participants, who had experienced at least 2 skin cancers within the past 5 years, the objective was to assess the efficacy of nicotinamide. The participants were randomly assigned to receive either 500 mg of nicotinamide twice daily, or a placebo, for a duration of 12 months. After 12 months, the results demonstrated a significant reduction in the rate of new skin cancers, by 23% in the nicotinamide group compared to the placebo group. Additionally, the number of actinic keratoses, a common precursor to skin cancer, was found to be 13% lower in the nicotinamide group at the end of the 12-month period. Importantly, no significant differences were observed between the two groups, in terms of the number or types of adverse events reported during the intervention period. These findings suggest that nicotinamide supplementation can provide a substantial benefit in reducing the incidence of new skin cancers and actinic keratoses over a 12-month period. Furthermore, the intervention was well tolerated, as no notable differences in adverse events were observed between the nicotinamide and placebo groups. Polydatin, also known as pisiad, is a glycoside form of resveratrol that can be found in various plants, such as polygonum, peanuts, grapes, red wines, hops, cocoa products, chocolate products, and many common dietary sources. In traditional Chinese medicine, tiger's cane has been utilized for the treatment of infections, inflammation, and cardiovascular disorders. Polydatin possesses a range of biological activities, including anti-inflammatory, antioxidant, immunoregulatory, nephroprotective, hepatoprotective, antiarrhythmic, and anti-tumor properties. Notably, polydatin has been shown to directly inhibit glucose 6-phosphate dehydrogenase G6PD. While there is substantial preclinical evidence supporting the potential benefits of polydatin, there is currently limited data from clinical trials, specifically focusing on its use in cancer treatment. More studies involving patients are needed to evaluate its efficacy and safety in this context. Further research will help to establish a clearer understanding of the potential role of polydatin in cancer management. Quercetin is a flavonoid nutrient found abundantly in fruits and vegetables. The therapeutic potential against cancer lies in its multifaceted mechanisms of action. This aligns remarkably well with our core anti-cancer strategies based on cancer hallmarks. Our first line of attack is through anti-angiogenesis. Quercetin effectively inhibits the process of angiogenesis, the formation of new blood vessels that supply nutrients to growing tumors. By suppressing key angiogenic factors, quercetin starves the tumor of the nutrients it needs to grow, effectively halting its progression. Next, we see quercetin's role as an anti-inflammatory agent. Chronic inflammation is a known facilitator of tumorigenesis. In terms of metastasis, the lethal spread of cancer cells, quercetin presents itself as a potent anti-metastatic agent. It interferes with the adhesive and invasive properties of cancer cells, thereby restricting their ability to spread to distant sites in the body. On a molecular level, quercetin's potential in the downregulation of mutant p53 proteins offers a significant inroad. The p53 protein, often dubbed as the guardian of the genome, when mutated, loses its tumor suppressive functions. Quercetin, interestingly, has been shown to downregulate these mutant proteins. Moreover, quercetin holds the capacity to induce G1 phase arrest. It interferes with the cell cycle machinery, effectively halting cancer cells in the G1 phase and preventing their replication and proliferation. We also see quercetin playing a pivotal role in tyrosine kinase inhibition. These enzymes are crucial for various cellular processes, including cell division and growth. Quercetin acts to inhibit these enzymes, effectively disrupting the signaling pathways that lead to cancer cell growth and survival. The downregulation of cell survival mechanisms is another front where quercetin shines. It inhibits the survival signals within cancer cells, thus rendering them more susceptible to anti-cancer therapies and reducing the likelihood of treatment resistance and recurrence. Quercetin's anti-proliferative effect comes into play by obstructing the rapid, uncontrolled multiplication of cancer cells. This attribute hits cancer where it hurts the most, by tackling its defining characteristic, uncontrolled growth. Finally, quercetin shows promise in programmed cell death. This natural form of cell suicide is often dysfunctional in cancer cells. Quercetin can help restore this balance, encouraging the self-destruction of cancer cells and preventing tumor growth. While the scientific exploration of quercetin's effects on cancer is abundant, we find ourselves facing a notable dearth of clinical studies in this domain. Quercetin has demonstrated promising anti-cancer properties in preclinical studies. The lack of substantial clinical trials poses a significant challenge in understanding its true efficacy in human cancer patients. There is no consensus on the optimal dosage of quercetin in cancer treatment. Various dosages ranging from 500 mg to as high as 5,000 mg daily have been reported in anecdotal evidence. However, without rigorous clinical trials, we cannot definitively establish the most effective dose for patients. While the absence of severe side effects is encouraging, we must acknowledge that the absence of knowledge is not equivalent to the absence of risk. Without rigorous clinical trials, we cannot thoroughly evaluate the safety profile of quercetin, its potential interactions with other medications. Resveratrol, a compound naturally found in the skin of grapes, red wine, peanuts, pineapples, and mulberries, has shown potential in cancer research. However, clinical trials focusing on its impact on cancer are relatively scarce. From the data available, it appears that the daily dosage of resveratrol can vary widely. Some studies have used as little as 75 mg twice daily, while others have administered doses of 0.5, 1.0, 2.5, or even 5.0 grams in early clinical trials. It's suggested that a daily intake of 500 mg or 1,000 mg may be adequate. Regarding its effectiveness, no definitive conclusions can yet be drawn, as no human trials have been completed that report on resveratrol's impact on cancer treatment. As for side effects, they tend to be mild, usually involving gastrointestinal symptoms. However, it's important to note that consuming high doses, such as 5 grams daily, may pose a risk of kidney failure. Therefore, moderation and medical supervision are advised when considering resveratrol supplementation. Resveratrol, a compound widely recognized for its potential health benefits, has drawn particular interest for its anti-cancer properties. This is primarily due to the overlap between resveratrol's targets and the metabolic reprogramming pathways in cancer cells. Indeed, resveratrol's mechanisms of action align with several of the core hallmarks of cancer. A key aspect of resveratrol's anti-cancer effects is its ability to inhibit three crucial enzymes in the glycolytic pathway: hexokinase, phosphofructokinase, and pyruvate kinase. This wide-ranging impact suggests that resveratrol has the potential to influence almost all 10 recognized hallmarks of cancer. Resveratrol plays a multifaceted role in combating tumor cell behavior. It downregulates the enhanced glycolytic activity commonly seen in tumor cells at multiple levels. This has the dual effect of facilitating apoptosis, or programmed cell death, in these cells and also restraining their proliferation. Furthermore, resveratrol might also counteract metastasis and tumor invasion by inhibiting inflammation and angiogenesis. Interestingly, the anti-cancer effects of resveratrol seem to exhibit selectivity for cancer cells, exerting minimal toxicity on normal cells. The low pH environment surrounding tumor cells, a result of increased lactate production from enhanced glycolysis, may actually amplify resveratrol's pro-oxidant anti-cancer activity. Currently, several clinical trials are underway to evaluate resveratrol's efficacy in both the prevention and treatment of cancer. While early experimental and preclinical data are promising, we must patiently await the results of these trials to understand whether this potential can be fully realized in a clinical setting. Now, I am going to shift the topic to a very important but seemingly simple supplement, vitamin D. The role of vitamin D in mitigating cancer risk and decreasing mortality rates has been a subject of numerous studies over the years. Various meta-analyses of observational studies have identified inverse correlations between serum 25-hydroxyvitamin D, namely 25-OH vitamin D levels, and the occurrence of 12 different types of cancers. A detailed analysis of 25-OH D level and cancer incidence rates postulates that elevating serum 25-OH D levels to 80 nanograms per milliliter, from 10 nanograms per milliliter, could potentially lead to a remarkable 70% reduction in cancer incidence rates. Mechanistically, several studies provide evidence that vitamin D can inhibit tumor cell proliferation, dedifferentiation, and invasion, and simultaneously sensitize cells to pro-apoptotic agents, such as chemotherapy. Furthermore, vitamin D has been shown to modulate the biology of various types of stromal cells, including fibroblasts, endothelial cells, and immune cells, in a manner that inhibits the emergence of metastases. In summary, the existing mechanistic data strongly supports the overarching protective role of vitamin D against most types of cancer. Now, let us look in detail at an excellent clinical study of vitamin D supplementation in cancer. Researchers from Dana-Farber Cancer Institute, associated with Harvard and Yale School of Medicine, ran a clinical trial to see how vitamin D affects cancer. The trial was called the Sunshine Trial. In the Sunshine Trial, they divided 139 patients with metastatic colorectal cancer, which had not been treated before, into two groups. One group took a much higher dose, 4,000 international units of vitamin D each day along with their standard chemotherapy. The other group took just the RDA dose 400 units, about the same as in a multivitamin, with their chemotherapy. In their study, they found that patients who took a high dose of vitamin D did better, and those who took the high-dose vitamin D were 36% less likely to see their disease progress or to die during the 2 years follow-up period. I think this study is very important because it shows that vitamin D could be a new, cost-effective, and non-toxic treatment for metastatic colorectal cancer, and the outcome could be even better if we optimize vitamin D levels to 75 or 100. The key takeaway regarding supplements for cancer is as follows. For the majority of cases, it is advisable to take vitamin D, aiming for a target blood level between 75 to 100 nanograms per milliliter, and melatonin at a dose of 20 milligrams per night, as indicated by the highlighted green color. These two supplements, vitamin D and melatonin, are safe and supported by solid clinical trial data. However, it is unclear whether or not higher doses of melatonin, meaning higher than 40 milligrams per night, is safe for long-term use. Additionally, several other supplements, such as EGCG and curcumin, which are underlined in this discussion, are backed by substantial patient data and have a history of safe traditional use. These options are highly recommended for most patients, as long as they are not contraindicated. On the other hand, while the remaining supplements have scientific backing, there is often limited patient data available. Therefore, their usage can be considered optional on an individual basis. It is important to exercise caution and consult with healthcare professionals before incorporating any supplements into your regimen, especially if you are undergoing cancer treatment or have pre-existing health conditions. Healthcare professionals can provide further guidance and ensure that the supplements align with your specific needs and treatment plan. Thank you for tuning in. As you know, the field of supplementation research in cancer treatment is highly dynamic, with new data constantly emerging. We will periodically update you with the latest information, so make sure to follow us on this channel and our website, i2b.us.